Tomiwa. Kunle.
My lord.
Yusuf. Let me tell you 5 dangerous habits that you are doing daily that are very, very harmful for your teeth. Number 1, you are drinking carbonated drinks. You open the bottle, you don't. You're enjoying yourself, Abby. You are damaging your teeth. You see, those fizzy drinks, carbonated drinks, they are very, very acidic. And every time you drink them, what they actually do is that they erode the enamel. They cause what we call chemical erosion of the enamel. So your enamel is getting thinner. It's like it's dissolving your teeth. Let me just put it like that. And your teeth is getting thinner and thinner. And then before you know it, your teeth will become sensitive. And then your teeth now begins to break because it's now so thin, you just eat one piece of bread and the thing will do boom and it's broken. The second dangerous thing that you're doing, we are in the era of healthy. Everybody's drinking, I'm drinking lemon water, warm lemon water in the morning. Ha! Carry on. You're drinking lemon. Those things are very, very acidic. Very acidic. And they will also be doing what? Eroding the enamel of it. It will be dissolving it. Just like the fizzy drinks or the carbonated drinks, it will be doing the same thing. So, and then if also you're taking a lot of pineapples, you know, your smoothies, pineapples, you're drinking all this, they are very acidic. And they can be causing enamel erosion because those things are really harsh on the teeth. Now, I'm not saying you shouldn't drink your smoothies and your pineapples. If you must, drink it with a straw. If you are still here, subscribe, like, and share. Let's continue. The third dangerous thing that you may be doing that is damaging your teeth. Are you brushing last thing at night? After you have eaten all those things, you have eaten a mini burger, a mini all these things, then you now go and sleep like that at night.
If you want to talk to me direct.
I'm looking at you in 5D. I'm looking at you in 5D. In fact, let me tell you, let me shock you. Do you know that brushing last thing at night is even more important than brushing in the morning?
I know, yeah, you were.
I'm not saying you shouldn't brush in the morning, no. Okay? We brush in the morning to keep our friends, but we brush at night to keep our teeth for a lifetime. Yes, because after you have eaten all those things, when you now brush at night, you take out all the food particles, all the things that the bacteria could walk on while you're asleep. Because you see, when you sleep, the body rests. And even the saliva in the mouth, the flow of saliva reduces when you sleep. And so those bacteria will come out, you know, like a thriller, and all those zombies, they'll come out to come and feast on the remnants of food, the sugars in those food while you sleep, producing acid that destroys the teeth. And because the saliva flow is reduced, it's a dangerous thing. Imagine it going on for 8 hours while you sleep. And so that's why it's important that you brush last thing at night, because when you brush, you actually mechanically take out remnants and pieces of food. So when the bacteria come out to play, there's nothing to eat. You starve them. And then you keep your teeth for a lifetime. The next one, some of you are smoking. You are vaping. You are smoking igbo. Ice. You are taking all those things and you are feeling very cool and fly.
What I'm trying to say.
But what you don't know is that those things are killing your teeth.
Are you serious?
They're killing your teeth. A lot of times, the smoking, the igbo, and all the things you know you are smoking, I'm not here to promote it all. They're destroying your teeth. I find out that a lot of people who do these things, when they come to the clinic, they have cavities in areas that normally they should not have cavities. They are having cavities in between the gum line and the tooth. And those places, ideally, you shouldn't have cavities. In fact, some of them come in, you don't see any cavity on the tooth, but they have a big abscess. There's pus in the bone underneath the tooth. That's what brings them, the pain from the abscess. If you look at the tooth, you will barely see the cavity. But when you take an x-ray, you see the tooth. The smoking has eaten up all the inside of the tooth. The tooth is dead. So just imagine if this kind of effect is going on in your teeth and in your mouth as a result of smoking, vaping, and all these dangerous things. And don't forget that these things can even cause oral cancers. Imagine what's going on all the way inside. Think about it. Let it sink. The next dangerous thing that you could be doing that is harmful for your teeth, and all of you are doing it, you are cracking bones. I'm looking at you in 3D. Somebody still told me, I went to one owambe, like owambe thieves, and I was eating chicken. Groom, groom, groom. It's very crunchy. Doctor, we have to eat the bones. The marrow inside is very tasty and yummy. Continue. Very tasty and yummy. But please, excuse, sir and ma. The cracking of bones is very dangerous for your teeth. I've said it before, when you crack bones, it's actually similar to throwing stones at your windscreen. It may not shatter, but it would leave thin crack lines. And as you drink hot water, cold things, remember that I said the tooth expands and contracts. And before you know it, pieces of your teeth will be falling out. I know that we are all doing it. You are eating momo, you are cracking the bone. You are eating chicken, you are cracking the bone. You need to desist from these things. There are no benefits to cracking of bones. They are actually very harmful for your teeth.
I just want you people to open up to me.
If you have found this video helpful, please like, subscribe, and share. The dentist is your friend. My name is Dr. Joan Agbanihena.